Well, first of all, the death toll, 427 new deaths announced just in the last 24 hours. I mean, that's like a shocking number, and it does bring that total, as you said, to a number that is over the number of deaths in China. So this is quite a shock for Italians, and it certainly will help to try and keep some of the people that are still out on the streets in their homes. What's happening, of course, is that companies and production facilities are having to implement ever more stringent rules to allow their facilities to keep functioning. So you have to distance people in the offices. You have to guarantee different entrances for different parts of factories. And so all of this, of course, is making it so that production is actually slowing down. Also because workers are asking for more safety, because not all the companies, according to some of the workers, are actually applying all of the requirements, or that they're not being careful enough. And of course, as people come out with confirmed coronavirus infection, offices and production facilities have to quarantine all of their workers that had anything to do with these people. So clearly, things are slowing down inevitably because of the way that the numbers are increasing. But Giuseppe Conte did make an announcement that he does think that he may need to extend these measures, these very strict measures, beyond the first date that was announced, which was March 25th, and also did make comments about the fact that they may need to make more stringent measures, so make it to the point where you can no longer leave your house. Of course, this would be very difficult. So I think they're hoping that this kind of fear that they're putting into the Italians' minds will help them stay home more than they have so far. But they are overall cooperating. Overall, it is a strong, disciplined, united front that Italians are putting out there. But, you know, there may be a need for stronger measures, in fact.
Right. Claudia, I just wanted to get into the people that have been affected so far by coronavirus, because here in the UK, we're still very early doors. And what we're hearing is if you have a problem, call emergency services. But you sort of get the sense it's the older people, the elderly, who are going to need those services most. This changed yesterday, and we saw some of the comments that came out of France that about 50% of patients in ICUs are under 60 years of age. What are you hearing from friends and family about the requirements for some help from hospitals to have some sort of intervention?
All right. Well, Karen, this is, of course, my personal experience. What I can tell you is we are, of course, in Lombardy, so it is the region with the highest number of cases. So we are the ones who are in the most difficult position, and medical staff are trying to respond to the needs. So I can tell you what's going on here. It is difficult to get a test. If you are sick, and I have friends who are sick and obviously have the fever and the cough, they call the number that you are requested to call. They follow them, but they don't immediately go out to test them, because they just assume that they have the virus and tell them to stay isolated from the rest of their families. Once you do go, have these symptoms for a protracted amount of time, I can speak of friends that have been sick for 10 days, for 14 days, finally getting more medical attention, and some of them having to now be in hospital with oxygen. Some are intubated. So, and these are people that I know. These are people that are in our age group, the age group you were mentioning, between 50 and 60. So this is not, as we initially, even in Italy, perceived, a virus that affects severely only the elderly. It's just not the case. And I can say that because I am living it with people that I know. So it is, and in the best case scenario where you are sick at home, or you go into hospital and then they send you home because you don't need the oxygen, you are having to, battle with fever and very difficult conditions for many weeks. So this is definitely more serious than we would have initially thought, Karen.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.